All right, we'll go ahead and get started. Thank you all for being here for our COVID-19 vaccine media availability. Got a full slate today. We'll start it off with Renown Health and Melody Osborne. Then we have another special guest, Dr. Trudy Larson, and then follow that with James English from the Washoe County Health District COVID-19 Operations Chief and District Health Officer for Washoe County Health, Kevin Dick. Melody, if you're ready to start us off, please unmute and go ahead.
Great, thanks, Scott. So this week, Renown is administering second doses of the COVID-19 vaccine to community members who are 16 years and older. We'd like to take a moment just to remind anyone who received their first dose of the vaccine with us to schedule their second dose at their earliest convenience. June 4th will be the last day that we offer second doses at our drive-through clinic. Any ongoing updates will be provided at our covid.renown.org vaccine site. And Scott, those are my updates for today. Thank you.
Okay, thank you very much, Melody. Now I'll introduce Dr. Trudy Larson, and I don't know if you guys saw the tweet from Governor Sisolak yesterday, but May 14th, 2021 was an honoring Trudy Larson for her 44-year medical career dedicated to medicine, health, education, and public health. And the governor went on to say she's been instrumental in our state's medical advisory team, and that he wishes her the best in retirement. So with that introduction, Dr. Larson, if you're ready, please go ahead.
Hi, thank you for having me today, Scott. So I was asked to talk a bit about the new recommendations for vaccinating our kids between 12 and 15. We've had the indication for Pfizer for 16 and over for quite some time, but this adds to that for, again, Pfizer to allow for administration of the 2 doses of the vaccine for those that are 12 and older. So I think it's really important as a backdrop to remember that children get infected, they do get sick, and they do spread COVID-19. Currently, approximately 25% of the new cases being reported are in children. So they continue to have transmission risks, and vaccination is one way to interrupt this quite successfully. So let me talk a little bit about the recommendations for this group. First of all, it is the Pfizer vaccine, and it's the same dose with a 3-week period of time between the 2 doses. And the study that actually looked at this specifically enrolled over 2,000 children between 12 and 15 years of age. They were randomized, meaning one was assigned to get the vaccine, another was assigned to placebo, and nobody knew which one got which injection. They were followed for 2 months after the second dose, and they were looking for evidence of infection. In addition, a small subset also had blood draws to look at antibody production. So the antibody production was very vigorous, as you might well imagine. Children actually do a much better job than adults do at making antibodies, so they had a very robust antibody response. And when they looked at cases in those after 2 months, following the second injection, there were no cases in the over 1,000 children who received the vaccine, and there were 16 cases in the children who received placebo for 100% efficacy. Now, this is a smaller trial than the big adult trial, but similarly, this trial shows that this vaccine has a really significant effect in protecting this age group from COVID-19 disease. I think it's important to remember as we look at safety issues for children, they had the exact same issues that adults do, with one extra, which I'll talk about. They got sore arms. They felt maybe a little bit off the next day. These were very limited side effects that were observed. There were no significant side effects at all in this group. And the one thing that we know about in adolescents is they have a higher propensity to actually faint when they get any injection. So one of the caveats that we always have had at the health department when giving vaccinations to adolescents is that you observe them for about 15 minutes to make sure they're not getting faint or that they don't faint. And if they have a history of fainting, you lay them down flat to get their vaccines. That is not a side effect of the vaccine. That's a side effect of the injections. And we've known that for a long time with the adolescent vaccinations. As you know, this vaccine represents a piece of RNA that codes for a significant protein in the coronavirus. As such, it has a very specific site of activity, and that is that it produces antibodies. And that antibody then is protective. We still do not know how long this immunity will be in effect, much like with the adults, but that is an ongoing trial for both the adults getting vaccines as well as the adolescents getting vaccines, going further on to look at protectiveness, and particularly as we worry about new variants, that these vaccines continue and have continued to be very successful, but certainly looking at those long term will be very important. So with that, if there are any questions, I would be very happy to answer them.
Thank you very much, Dr. Larson, for that update. We'll go ahead and save the questions for the end. Let's get to James English from the COVID-19 response team. James, if you're ready, please go ahead.
Thank you, Scott. Good morning, everyone. And I'd like to thank Dr. Larson, too, for her years of service here with the state, our community, and here at the Health District. Only recently have I worked so closely with our immunization program in this new role and did not realize how much effort she puts in behind the scenes for our vaccination process here at the Health District to make sure we're following proper procedures and doing everything in a safe manner. With that, our pod has moved to the new location over on the west side of the RLEC parking lot. That move was done even with the adverse weather and made our time schedule to open up yesterday at 3 o'clock. We had cars being vaccinated at 3 p.m. Therefore, for everyone out there, our new location main entrance is the Sadler Way off of Wells Avenue. Many of you will recall this is where we entered everyone for testing last summer and all the fall. I'd really like to thank the National Guard, FEMA staff, volunteers, and Health District staff to help make this move happen. Saturday, it was pouring rain and lightning around us when we did the final infrastructure move over and worked around the construction crews. They also worked all day Monday and Tuesday to get ready to go. We also had a few other, of course, weather's our biggest problem and factor out there. And those last 2 days of large vaccinations last week and the heat with no shade from the roof structure was difficult on staff. So I appreciate their efforts there. Today, we have partnered with the food bank in Baldini's Casino and are offering a pop-up clinic over at Baldini's. Staff is out there right now. We're also operating our on-site pod here at the Reno Sparks Livestock Event Center. And that's what you're going to see the Health District attempting to do going forward, both some community-wide pods and continue to operate here as we continue to see a large demand in vaccinations. Furthermore, we will be over at Little Flower Church next weekend, and we are working with the school district to work on some pop-up pods at their schools to help vaccinate the group Dr. Larson was talking about. I'm pleased to state that as of today, we will surpass here at the Health District administering over 100,000 Pfizer vaccines doses. We will also have administered over 160,000 total doses here at the RLEC pod in our homebound program at the end of the day today. And finally, over 76,000 total people will have been fully vaccinated through the Health District's efforts, which couldn't be done without all our volunteer support, our FEMA support, federal resources, and of course the National Guard. So with that, Scott, I'll pass it back to you.
All right. Thanks, James. I'll now send it to District Health Officer Kevin Dick.
Yeah, thank you, Scott, and thanks everybody for joining us today. And a special thank you to Dr. Larson. I just want to also add, how fortunate we are to have her here in Washoe County, leader of the School of Community Health Sciences at UNR, a physician and a pediatric doctor at that. with expertise in immunizations and a member of the governor's medical advisory team. So appreciate her providing her information and expertise on the vaccinations today. And as we saw yesterday, the Washoe County is no longer flagged under the state's county tracking system for any of the criteria. We certainly hope that it stays this way, but it shows the progress that we're making against COVID-19 in the community. Our case rates per 100,000 people are now down below 200 for the first time since the county tracker system was created. We're at 186 new cases per 100,000 over a 30-day period. And our test positivity rate is now at 4.6%. So those are both excellent signs for how we're doing with COVID-19. As Jim had mentioned, it was quite an effort to move the pod over the last few days in some less than ideal weather conditions. And so I want to thank all of the staff members, volunteers, National Guard that were involved in planning that effort and executing it over the weekend. We were back up and running yesterday afternoon in our new configuration, and it was performing quite well. So encourage people to show up to be vaccinated through our operations at the Livestock Event Center. We have Pfizer that's available Thursday and Friday this week. So those that are 12 years old and are old and older are eligible and can be signed up for getting vaccinated with the Pfizer vaccine Thursday and Friday. I do want to give a little shout out for Washoe County and the tremendous job that our residents are doing getting vaccinated here. On a per capita basis, we're doing very well with the number of people that are vaccinated. We have over 81,000 doses that have been administered in Washoe County per 100,000 people. To give you a comparison, Clark County is just under 66,000 doses per 100,000 people. So again, we're at over 81,000 per 100,000. Clark County, a little less than 66,000 doses per 100,000. So our residents are doing a fantastic job in making the effort to get vaccinated and move beyond COVID-19. And I think we've seen in the last week with the new CDC guidance reinforcing the science behind how effective the COVID-19 vaccines are and the reduced risk that vaccinated individuals face. And there are a lot of people that are now taking advantage of the mask guidance, allowing vaccinated persons not to wear a mask indoors and outdoors. And for many, this is a sign, as it should be, that things are changing for the better. And I believe that it's also motivating some of the people in our community that were hesitant and holding back to go ahead and get vaccinated to be able to be back more to normal and not being required to wear the mask. But it's also important to remember that it's not easily possible to recognize who's been vaccinated and who isn't. And if an establishment does have a rule to wear a mask, that you should be observing that and wearing a mask regardless of your vaccination status. Also, I would add that the CDC guidance is not a requirement that you not wear a mask if you're vaccinated. And I believe that there are many people in our community that are vaccinated but are continuing to wear masks as a courtesy to others that they're around in public and to essential workers, et cetera, that they care about them and want to make sure that they feel protected. So just a reminder to people about that. And for people who are still on the fence, I think the CDC guidance is really clear indication of how well the vaccine works, and it's a safe and effective vaccine. We have more than 124 million people who have now been vaccinated here in the U.S. And if there were any major health issues with the vaccine, with a population that size, I think it would be pretty well known and identified by now. So we're asking people to please continue to be tracking the information and the science about the vaccine, to talk about the vaccine with other people that they trust, to talk with their physicians about it, and keep an open mind and in making a decision about what the benefit may be to them to become vaccinated, to them, to their families, and to their community. A reminder that the vaccine is free and it's available. So it's one of the easiest things that you can do to prevent the transmission of the disease. I think I know we're all quite tired of the social distancing, limited occupancies, wearing masks, et cetera. The vaccine is really our ticket to keep moving forward and get beyond COVID-19. With that, I just wanted to touch on, we are in graduation season now at UNR, and moving to that in the high schools. And I just would encourage people to continue, though, to practice precautions with folks that may not be fully immunized in those gatherings, and particularly as we're getting into school graduation celebrations, et cetera, where some of the students may not have been eligible for vaccines until very recently, that may be present at some of those gatherings. So encourage people to be careful and try to avoid any transmission events that might come out of those gatherings. With that, I'll turn it back over to you, Scott.
All right, thank you very much for that update, Kevin. We'll now move it to question and answer. Please direct your question to either Melody Osborne, Dr. Larson, James English, or Kevin Dick. So if you have any questions, please go ahead.
Hi, James. This is Kenzie with News 4. I know you briefly touched on this, but how important is it to bring these vaccine pods into the communities? You know, churches, casinos, baseball games. How crucial is that to make that push for herd immunity?
I think that's really critical. What we found this past weekend is that when we can get out in the community, anytime you can give a vaccination is great. So we want to make it as easy as possible for everyone. We're also working really hard to support all our other community partners who are also attempting to do this. CHA is doing quite a bit of community pods, but it's extremely important to continue to get out there and make this vaccine as easily as possible. When it's available and people see it, sometimes I think they think, okay, I can just go ahead and get this done really quickly. So we're going to continue to work on that. We're going to continue with our messaging, and Scott, and any way we can get this vaccine out, that's what my goal is over the next few months, to try to get as close as possible to herd immunity.
And are you guys seeing any renewed interest with the vaccines after the CDC's recent announcement? You know, maybe people saying, well, if I don't have to wear a mask, maybe I will get the vaccine.
That is very hard to tell, because unless we were to run a questionnaire for why they're signing up, I can't speak to that. But what I can say is we've actually gotten complaints over the past week that our pods here at the health district are full. And we have seen people walking onto our property all weekend during the move, yesterday and Monday, looking for where our vaccinations are given. And we've been given the information of the local pharmacies around us. But I do think there's a renewed interest, because we had a very high demand for appointments this past week, even though they're not required. And we're adding to our pod as much as possible as we work out the final logistics of the move. Obviously, yesterday was the first day, and we're continuing to do more and more vaccinations each day in this new configuration.
Hey, this is Brian Hoffman with 2 News. I am wondering, I was going to ask if it has gone down at all, if everyone that wanted a vaccine is kind of getting one. But since it is renewed, I guess my question would be, at what point do we get to when everyone who wants a vaccine or can get a vaccine, and are we still ordering the max amount that we can get? I believe it's through the state. And just any question on what you're doing with extra doses, because I know you're trying not to waste any doses whatsoever.
Yeah, Brian, this is Kevin. I'll go ahead and take that. As far as the availability of the vaccine, we do have vaccine available. And so, as I'd said previously, I think if anybody was holding back to make sure that others that may be more in need had an opportunity to get vaccinated, that time has passed. And so people should go ahead and get vaccinated either through our pod at the Livestock Events Center or the local pharmacies, et cetera. Because the vaccine is available. And while we're seeing a renewed interest right now and demand with people signing up through our pod, we did have the vaccine that we had previously ordered, and we wanted to make sure that we utilized the vaccine that we had on hand within its shelf life. Rather than stocking up on a lot more. So we haven't been ordering the maximum amount, but there's adequate supply available. We'll be continuing to order and continuing to administer through our pod. Did it cover all your points?
Yeah, I believe so. And actually, while I got you, Kevin, I kind of wanted to ask what your opinion is with the Washoe County School District's decision on allowing kids 12 and under not to wear masks, even though that's contrary to what the CDC says, and I believe it's contrary to what you recommended as well.
Well, I support the CDC guidelines, and it's certainly the school district's purview to make that decision of what their requirements are going to be within their operations as a school district. But I've tended to defer to CDC guidance and the strong team of scientists that they have there.
This is Siobhan with the RGJ. I kind of wanted Dr. Lawson to answer that question as well. And she talked at the beginning about right now 25% of the cases are children. Is there a worry that that number now will go up since they're the group that can't be vaccinated in most cases unless you're over 12?
And so that's a really good question. I tend to err on the side of caution, and I found it quite difficult to transition to going without a mask. So I appreciate the concern that some parents might have, and I would encourage them, if they're worried, to let their children continue to wear masks and to let others continue to wear masks until we all feel confident that we have enough decrease in the transmissions and enough vaccinated folks that will not be the case. Having said that, smaller children do not transmit the same way as older children do. And so that's been one of the very interesting things about this particular pandemic. So they're less likely to transmit to others. They're less likely to get really ill. Within that breakdown of 25% are in children, it does not really break down whether it's that 12 to 18 group, which I would expect it to be, because they're more likely to transmit. Far fewer transmissions in the lower age groups. Which is very encouraging. And I suspect by this fall, we'll have an indication for kids from above 2 years of age.
And by indication, you mean a vaccine would become available?
Yes,
Yep.
yes.
Okay.
The trials will have been completed, and we'll have really good evidence and more information at dosing, for example, by that time.
Does it worry you that with all the variants that, every time it even goes in a kid who doesn't transmit it, that the virus changes a little bit? I know the health lab has talked about that a lot. Could young kids be responsible for the virus changing a little bit, or that kind of goes along the same lines of what you were saying before?
So that is a good point. As long as there's virus that's being transmitted, there's a potential for mutation, which is what causes the variants. The higher the vaccination level, the less transmission, the less likelihood of variants developing. So I think, our push to now get the 12 to 18-year-olds where there is far more transmission and more risk of that mutation occurring is really a very good step forward. And certainly we may see others as we begin to finally address those that are under 12 years of age. But again, they're less likely to transmit. They're less likely to be the cause of the variants. It's really the group over 10 to 12 years of age that are far more likely to have that transmission. And that's the group we worry about, but now those 12 and over can get vaccinated.
Any other questions?
Yes, hi, this is Laura with Reynaldia. I just have a question about if there's any group or any organization that can help educate the people who doesn't want to get the vaccine because they're hesitating on getting it. Because we have some people asking how can they convince their family members to get the vaccine.
Well, I think that you know, they can certainly contact our health district to talk with people about the vaccine. The physicians, their friends. I would point out that we have had several of our leaders in our faith-based communities that have stepped up and have helped in leading some vaccination efforts. So I think those are some of the places that people can go for those discussions. I don't know, Scott, if you have anything to add to that.
Yeah, Kevin, I think one of the things that we had put out in our daily update is the CDC actually has some suggestions on how to talk to people about the vaccine. But some of the information that they release is a lot of convincing from people to people about getting the vaccine. It's coming from friends and family. Not everybody's gonna, read the same type of news source or anything like that. A lot of the conversations about the vaccine are going to come at the family level. So I can send you some more data on that, Laura, just in terms of kind of how they even have like suggestions on how to bring it up, how to, ease some of the concerns and really just clear up any misinformation. Because we all know that, when we first started vaccinating, there was some certain groups out there that were, putting out information that was absolutely inaccurate and scared off a lot of people, especially on some of the younger audiences on social media. So I think, for the most part, getting the correct information to people and just having those discussions and being equipped to answer some of those questions is probably the most important thing.
Okay, yeah, because they're really concerned because most of the family members got the vaccine, but there's always someone who doesn't want to get it, and they're worried about that.
Yeah, no, absolutely. We're seeing that a lot. We're hearing about it a lot. I'll send you some information via email, and if we can also help get maybe somebody on your program to talk about it if you'd like.
Yeah, that would be good. Thank you very much.
No problem. Thank you.
Yeah, I had a quick question for you, Kevin. Kind of buried the lead there. I mean, Washoe County no longer flagged under any of the state's tracking system. Can you talk to us about how much of a big deal that is, and if the increased vaccination rate has anything to do with that, and if you happen to have a percentage of
the decline that we saw when people were really being responsible with social distancing and mask wearing. following the huge surge that we saw through November, and it really getting everybody's attention that this was for real and we needed to do something about it. And then that helping to bring down the numbers at the same time that we were able to begin providing the vaccinations. I think now we're also seeing the impact of the vaccinations and how effective they are in helping to keep those numbers low. And you know, we tried to work as well with our local authority plan to continue mitigation measures and not completely open everything up May 1st. And I think that that's helped for us to come to this good place with low numbers of cases while we're moving toward more fully reopening on June 1st and continuing to push vaccinations out in our community. And as far as the stats for vaccinations in our community, we're at just about 54% of our population 12 and older that has now received an initial dose of the vaccine. And we're at about 45% of our population that's been fully vaccinated. So we're on a good course, and I encourage people to join in, get vaccinated, and help us move back to normal.
Perfect. Thank you very much, sir.
Thank you.
And a lot of that information is in our daily update that we send out on Twitter, Facebook, and also have on the COVID19washoe.com website. Any other questions? Okay. Thank you all for being here. One last update. We have a COVID-19 vaccine community pod going on at Baldini's Casino today until 1 o'clock. If there's anybody who hasn't received a vaccine, we're doing the Johnson & Johnson vaccine. And one of the cool things about doing those community pods is we definitely get people that may not otherwise have received the vaccine. And I even saw it today when I was out there. People just happened to be walking by, seeing what was going on. And one of our National Guard people over there just asked a person walking by, "Hey, you want to get a vaccine?" And the person was like, "Yeah, sure, why not? I'll get a vaccine." So, you know, there never would have been an opportunity to probably get that person vaccinated up to this point unless we had been out in that community. And it really just goes to show you that the work we're doing is really making an impact and making it easy for people to get the vaccine. So that's all I got. This is being recorded, so it'll be on the website shortly. If you have any other further questions, feel free to reach out to me. Have a great day. Thank you.